Okay, welcome to the seventh session and the first of the season 2 of the Asia Undercurrent. My name is Kazuto Suzuki, and I'm going to moderate today's discussion. First, I'd like to thank the government of Japan and the Nikkei for organizing and sponsoring this seminar. And I think this is the first time that the Japanese person is moderating this whole series. So I am very proud of it. And we do have a wonderful set of panel who are talking about the lessons of the Japan's COVID countermeasures. First, Professor Oshitani from the Tohoku University Graduate School of Medicine, and Mr. Geroid Reidy, who is the senior columnist of the Bloomberg, and the Professor Zeynep Tufekci, who is teaching at Columbia University. So first of all, I'd like to, before we move into a discussion, just to give you the housekeeping announcement. When you put your questions in the box, please scroll down to find the box to put your names and affiliation. So please send your questions as much as possible, and we'll try to answer it as much as possible. Today, we are going to discuss Japan's countermeasure to the COVID-19. Japan has been quite successful in combating against the COVID-19. The number of cases and deaths are far lower than the other G7 countries without taking harsh measures such as lockdown. But since this is a global pandemic, the whole world suffers from the same disease, but responded differently. So that makes a very interesting to discuss internationally that this is a very good comparative cases of how to respond it. And also it is the wonderful time to think about and reflect of the Japan's response to the COVID-19. And what is interesting is that those countries with the cutting edge technologies and the research facilities, such as United States or UK, have faced a serious increase in the cases and deaths, while many Asian countries, including Japan, Taiwan, and South Korea, and to some extent, arguably China, which were relatively successful. So we are going to discuss why, and particularly putting a focus on Japan, why it has been successful and different from other Western countries. However, the initial incident of the Diamond Princess, of which the Professor Oshitani has involved extensively, this cruise ship incident, which called for a port at the Yokohama in February 2020, gave a very striking image that Japan mishandled the disease, which eventually set the tone of reporting in the domestic and international media. And that led to the sort of unified call for the cancellation of the Olympic Games. So this is another issue we'd like to discuss, that how this experience of the Diamond Princess gave an image of Japan, even though this incident gave a valuable scientific data to fight against the COVID-19, which has led to the logical and reasonable responses of Japan, such as avoiding the 3 Cs. And perhaps Professor Oshitani will explain that much more extensively. Japan's response was also criticized initially as a lack of drastic measures, and many countries issued warnings that the risk of infection is high in Japan by other G7 countries. The fact is, the Japan was much safer compared to those countries, and it wasn't really fully admitted. And there are many questions remain in that process that the obsession of this draconian measures was initially taken by China, and which still continue to implement the zero COVID policy. But this Chinese model was initially relatively successful and in the early phase, and many states followed this Chinese model, consciously or unconsciously. So in the contrast of the Chinese initial success, Japan's response was regarded as was a disastrous case because we didn't take the draconian measures and very limited to spread the disease. The idea of living with COVID was considered to be a bad theme, but today people are now talking about the living with the COVID all around. So how this changed is another issue that we like to discuss. So today, we would like to discuss the following. What caused the relative success of Japan's fight against COVID-19? What made the difference from the medical point of view as well as social point of view? Is it because of the Japanese medical success, or is it because of the Japan's, how people reacted to the COVID-19? And why are some governments and international media were so critical about the Japanese responses to COVID-19 when there were fewer numbers of infections, cases, and deaths per million in Japan? And another question maybe is what lessons can we learn from Japan's experience in light of serving, without the severe lockdown taking place? And if you see today's situation in China, particularly places like Shanghai, how do we see this approach to the COVID-19? So let me just pass the microphone to the panelists. I'd like to start with. It's kind of awkward to go with a first name basis, but this is a tradition of this webinar series, so I'll go with the first name. I'll pass with microphone to the Hitoshi for how did you come up with the idea of the 3 Cs? How did you see the international responses to this idea of 3 Cs? Are they accepted? Are they considered useful? Or was it really local Japanese responses? So please, Hitoshi.
Thank you very much, Professor Suzuki or Kazuto, for introduction. It's my great pleasure and honor to be one of the speakers of this webinar. I'm particularly delighted to speak with Zeynep and Geroid, since I've known them since early days of the COVID-19 pandemic. So I'm going to describe how we've been responding to COVID-19 in Japan. Actually, when global outbreak of severe acute respiratory syndrome, SARS, they occurred in 2003, I worked in WHO Regional Office for Western Pacific as a responsible officer for the emerging diseases. When I heard the news about discovery of a novel coronavirus similar to SARS coronavirus from pneumonia cases in China in early January 2020, I initially thought that this disease was the same as the SARS 17 years ago, which was successfully contained within 8 months. However, the accumulated data indicated that this novel coronavirus infection, now known as the COVID-19, was quite different from SARS. For SARS, most infected people develop very severe illnesses, and the transmission occurs only from severe cases. But for COVID-19, they are mainly mild and asymptomatic cases. And pre-symptomatic or even asymptomatic transmission, the meaning that the transmission from those in incubation period or without any symptoms are common. So these differences make COVID-19 much more challenging to contain. I was invited to participate in the expert meeting of COVID-19 and the Japanese government in February 2020. By then, I realized that the containment of COVID-19 required the very strict physical distancing measures such as lockdown. However, lockdown was not a feasible option under the Japan's legislation system. The meeting set the objective of COVID-19 response in Japan as early as the 24th of February 2020. The objective is to suppress the transmission to minimize the number of severe cases and deaths while maintaining social and economic activities. This means that we have been using living with COVID-19 approach since the beginning. However, to achieve the objective, we needed to develop alternative strategy to suppress the transmission. In Japan, public health nurses in public health centers have been doing extensive contact tracing, including so-called retrospective or the backward contact tracing. In most countries, they've been doing the only prospective contact tracing, which identified and followed the close contact of confirmed cases. In the retrospective contact tracing, on the other hand, they try to identify the source of infection by asking about the contact history before the infection. By analyzing the data obtained by contact tracing, we identify the critical epidemiological characteristic of COVID-19. The majority of infected individuals do not generate any secondary cases, while a small proportion of them generate many secondary cases and cause large cluster or super spreading events. Due to this over-dispersion of secondary transmission, the transmission chain of COVID-19 cannot be sustained without super spreading event. By identifying the super spreading event alone, it's not enough to suppress the transmission. Because when they identify the super spreading event, the event has already occurred. Then we try to find common risk factors for super spreading event to prevent the super spreading event more effectively. I have been conducting the research on respiratory viruses, including influenza, for over 30 years. I knew that the aerosol transmission could be the significant transmission mode for influenza. Summary data including the data of Diamond Princess, also suggested that the aerosol transmission could play a crucial role in COVID-19 transmission. Using this knowledge and early data, we identified the 3 common risk factors for super spreading event, now known as the 3 Cs or SAMIDs in Japanese, including closed environment, the crowded condition, and the close contact setting. We have been using this concept extensively to ask people to avoid high-risk activity and the 3 Cs, such as big parties. So far, we have had the 6 waves of COVID-19 outbreak, but the number of cases and the deaths per population has been significantly smaller than in other G7 countries, as Kazuto mentioned. The vaccine, especially messenger RNA vaccine, they are potent tool to minimize the impact of COVID-19, but I do not think the vaccine alone can end the pandemic. The COVID-19 is a very tricky disease. There is no single or simple solution for COVID-19. Each wave in Japan was significantly different due to different strains, different level of immunity, and implemented the interventions. The place where the super spreading event occurred have also been changing between the waves. The number of newly confirmed cases is slightly decreasing in Japan right now after the significant surge due to Omicron variant. This is partly because of population immunity induced by the third vaccination and the natural infection. But the data suggests that the people are still very cautious in resuming their activities. To minimize number of severe cases and deaths, the particularly avoidable deaths in the future wave, I believe that we should continue to implement and improve our response to COVID-19, including vaccination, the better clinical care, and public health measures. At the same time, we acknowledge that people are getting tired with some interventions, and some businesses are also severely affected by the pandemic. That we should continue to find the best balance between suppressing the transmission and maintaining the social and economic activities. Thank you very much for your attention.
Right. Thank you very much, Hitoshi. Yes, it's a very tricky disease, and I think this trickiness hasn't really understood well by the other countries. But I think in Japan, this is one of the success of the epidemiologists to tell and understand and make people understood that this is a tricky disease. So I think it was a success of Hitoshi and his colleagues to educate the Japanese people. So next up, Geroid, you are the international journalist residing in Japan. And how did you see the ways in which the international media reported Japan's response to the COVID-19 in the initial phases and throughout, and why it happened, and what was the problem for the misunderstanding or misperception of Japan's responses? You're right.
Sure, thank you, Kazuto, and thanks for having me. Thanks everyone for listening in. I'm Geroid Reidy. I'm a senior editor with Bloomberg News in Tokyo. I'm currently on secondment to our opinion team as a columnist, but I also covered a lot of the initial outbreak here in Japan, and I've been following it very closely ever since. So in terms of the international media perception of what's happening, as someone who's working in the media, and not just in the initial phase, but really throughout the pandemic, I think the difference between what the perception was in the media, the level of interest in what was happening in Japan, and the actual situation on the ground, there was probably a bigger gap, a bigger disparity than in most other major countries. For me, there was only really 2 times that the media outside Japan were truly interested in Japan. And that was, as you mentioned, the Diamond Princess and the Olympics. And both of those, I think, were really seen as sort of crisis moments. And the Diamond Princess in particular, I think, really set the tone for how Japan was regarded throughout the pandemic, because it occurred so early on in the pandemic, really the first sort of major incident that happened outside of China. And it was seen, rightly or wrongly, as something of failure. And, I think we'll talk about both of those moments in more detail as we go on. But for me, it doesn't represent, I think, how Japan weathered the pandemic. And I think there was a more interesting story here than was, that wasn't sufficiently examined. And that, I think, is, as we're talking about here, is Japan's performance in the pandemic in terms of deaths without having the type of lockdowns that we saw in many other countries. You mentioned the level of deaths. I find it very interesting to note that Japan has had, the lowest deaths per capita of any of the 38 OECD countries, with one exception, and that one exception is New Zealand, which famously had some of the strictest lockdowns and border controls of any country in the world. The only regions that sort of consistently outperform it are the ones that have explicitly pursued COVID-0, such as Taiwan and China, which is not something that Japan really ever attempted to do, even from the very early days of the pandemic. So without having pursued COVID-0, without having gone into lockdown and still performing pretty well, that is the part that I think should have attracted and arguably should still attract more interest, because as Professor Oshitani notes, we're not out of this thing yet. Not only did Japan sort of outperform, but it also did so without taking, the sort of unprecedented lockdown measures that many other countries in the world chose to enact. As I think you mentioned in your introduction, Japan adopted a living with the virus approach way back in May 2020, well before vaccinations. And I think that is the thing that, that's the thing to learn from, that Japan, not just Japan, I think South Korea as well, really took a third way that was neither lockdowns and or attempts to do COVID-0 or letting the virus rip through the population. But I think the debate in the Western media has often tended to come back to this dichotomy. And you can see that now when a lot of the Western media talks about the situation in China. It very much tends to be they have to keep COVID-0 or they must do what Western countries did. And one of them may be unpalatable, and one of them may be impossible. But I think it goes sort of underappreciated that there was this third way that potentially, anyone could have followed. So to go back to your initial question, I think how Japan was perceived was sort of first as a disaster, and then as a mystery, and then largely ignored for the rest of the pandemic, which I think is unfortunate because especially early in the pandemic, there were lessons to be had, but there wasn't really, I think, sufficient sort of interest in them. I'm sure many people listening to this will recall, in 2020, how many articles did you read about Sweden's approach to the virus? Sweden also, did not do lockdowns initially, sort of outlier in Europe. How many articles did you read about that? In 2021, how many articles did you read about something like ivermectin? Does it work? Does it not work? But with very few exceptions, I think there was very little attention being paid to, this country or these countries, because again, I would include South Korea, that were outperforming without doing lockdowns. And I would say the one exception to that is our next guest, Zeynep, who wrote so well about it all throughout the pandemic. I think we also saw this, during the Olympics. I recall myself before the Olympics, I was doing a lot of media coverage on other media from different countries, and I would inevitably be asked, how bad are things in Tokyo right now? Or why is Japan going ahead with the Olympics during the pandemic? Because the perception of how bad things were in Japan was not at all aligned with the reality of what things were like in Japan. We can talk about, some of those reasons. I think one of them is that people saw the language of state of emergency or virus state of emergency, and it sounds very scary, but there wasn't enough sort of attention paid to what were the actual things that were going on in the country and what were the measures that were being taken, which for much of the pandemic were something a lot closer to normal than I think a lot of countries had during lockdowns. How did we get here? I think, there's a lot of room for debate. What worked, what didn't work, what was a success, what was a failure, and hopefully we can go through that over the next hour and change. Possibly this panel here won't have a huge difference of opinion on some of those issues, but there's things that we understand. There's things I think that we don't understand, and I think it would be a good thing, going forward, to look at the successes and failures in Japan, both for the rest of this pandemic, for a future pandemic, and also, I think one thing that we'll want to look at and is like, how is Japan going to come out of this? Japan, as you mentioned, still has, and as Professor Oshitani mentioned, still has a very sort of cautious attitude towards the pandemic. Still with borders closed to tourists, even as a lot of other countries freely open up. How does Japan exit from that? Does it exit from it at all? I think there's still a lot to pay attention to. So hopefully this seminar can help in informing that, and hopefully we can have a lively discussion.
Right. Thank you, Geroid. It's yes. I think one of the problems that we have this webinar today is that we haven't really exited from. Nobody has exited from the COVID-19 and pandemic, but still, I think there is a lot to learn and a lot to watch out. And I think the Japanese cautious attitude may continue, but what will be the consequences? Is it the wrong choice or good choice? Who knows? But I think this webinar will provide some perspective of how we see it. So then, Zeynep, as Geroid mentioned, that you are the one who is watching and who is precisely debating about Japan's response. So what's your take from, what was the reason of success or reason of the relative success of the controlling the waves and the controlling the new cases? How do you see it? Just give me your synopsis of what you have thinking.
So obviously, like, not having gone through this in Japan, I don't have a sense of the measures in practice, right? I did not live through it. But what I can tell you is that the things that Professor Oshitani outlined early on, were clearly the key factors in understanding how this disease spread. And if you kind of go back to that period, the February 2020 with Diamond Princess, at the time, China, in fact, had been telling the world that there was pre-symptomatic transmission. I remember on January 26th, the Chinese Minister of Health had a press conference essentially saying pre-symptomatic transmission. And in a lot of Western countries, I mean, that's the one I followed directly, it was just discounted. It was like there was literally a response saying that's not possible. That is not how SARS happened. That's not how other viruses happen. In fact, I remember the responses from people who then ended up even in the task force in the Biden White House who said, no, this is not possible. And I remember thinking, wait, this is a new virus and the Chinese Minister of Health is telling us something. And for a long time, pre-symptomatic transmission just was not accepted. And at the end of February, the team, Professor Oshitani's team, had a little paper. It was kind of like a guidance document. And I remember reading it shortly thereafter. And one of the things that was mentioned was this. The other thing was the cluster nature of it. And it was later confirmed, of course, by more systematic studies, but we did find it's not true for the new variants, really, but for the early variant, most cases did not lead to secondary transmission. And at a time where testing was limited, in Japan, tests were limited, I know. In US, tests were limited because our tests weren't working. The one country that really did great use of tests is South Korea. They got ready very early with a testing capacity. So when they got really unlucky with that couple of church clusters, they were able to test very widely, but still it followed the same logic that you didn't really need to, like if you were going to prioritize testing, what you wanted to do was to find the original source of the cluster and test from there, because it's just basic math. If you have a transmission, there's probably other transmissions, right? If there's one, there's others. Whereas if you have an infection, it doesn't really mean that that infection is going to go anywhere else. So that was a very smart strategy, I think, to try to go back and trace the clusters and then go forward from there. And I think, and I just like, I kept, as I sort of sometimes joke about it, that February 2020 paper by Professor Oshitani and his colleagues, I keep writing like articles from pieces of it because it was so useful in understanding what we needed to do. And the third component, that we had a two-year debate with the WHO and CDC in the United States, was that the droplet precautions, which were focused on fomites, like that contact, weren't really covering what we were seeing, especially that kind of super spreading. It just wasn't happening through droplets. It was clearly happening through like aerosol transmission. And when I started working on that, because there were cases in the US of like choirs having super spreading events and things, it just didn't make sense that 90% attack rate, like 90% of people getting infected. So that aerosol transmission was the third crucial thing. So once you have all those things in place, I believe you can have a much more effective mitigation strategy, especially pre-Omicron. Like after Omicron, I'm not sure that secondary infection not going anywhere is necessarily true. It seems to be highly infectious. But I mean, the whole idea, which I think South Korea and New Zealand are two great examples of countries that managed to hold out really well until vaccines arrived. So the whole idea was to use these strategies that Professor Oshitani talked about to try to hold cases back as much as possible until vaccines arrive. And once vaccines arrive, you have now a new set of tools and issues. And it's a challenging, that pre-symptomatic transmission is very challenging because it also made it difficult to convince people. Without aerosol transmission and pre-symptomatic transmission, we couldn't convince people to wear masks or higher grade masks. So there was all these things that came from it. So I think, so case numbers aren't very reliable because a lot of countries don't test a lot and Japan doesn't test a lot. That's like, I don't think the case numbers are very good comparison, but it's the hospitalizations and deaths that give us a way to actually compare. And I think we really should go back and look at the countries that did really well until vaccines arrived. And Japan is one of them. And then after that, the vaccination rate became a crucial sort of dynamic. And I know there are some issues with that in Japan, but then later it caught up. So that's another thing. So in totality, I really think that those early findings from Diamond Princess and those early cases were crucial and very informative. And unfortunately, now it is fairly accepted. Now, even the WHO is saying, okay, aerosol transmission. It's kind of unfortunate that it took so long for the scientific establishment in other places to kind of get to that point. And one of the reasons I think is in the West, we think a lot about flu and influenza, and we don't even think about influenza as necessarily airborne. But as Professor Oshitani said, there's evidence it probably kind of is. And plus it's a novel virus, so you're not going to have the same kind of spread. So if we had been more thinking about SARS and MERS, but understanding the pre-symptomatic transmission, which is a key difference, I think we would have been much better off. And so that's why I think it's important to try to understand these comparative things in countries with, especially taking into the age structure and the density of the cities, and then compare to places and learn from it. Because next time, epidemics happen, pandemics happen, the earlier we figure these things out, as we have been discussing, the better the response can be.
Right. Thank you very much for the very comprehensive analysis of this comparison in the United States and others and Japan. And I think these 3 points of the mitigations about testing, masking, etc., is also a very interesting point of discussion. And I'd like to ask Hitoshi for the reasons why Japan didn't have enough testing in the first place during the Diamond Princess. One of the reasons why Diamond Princess became a sort of a tragic, because it was that it was a lack of testing, and therefore the number of cases were discovered in very slow paces because of the lack of mass testing. So, but in 2009, when there was a novel influenza, you are the one who promoted and recommended to increase the testing capabilities. How did you see it? What was the cause of the failure of the preparedness for this pandemic?
Thank you very much for your question. There are probably several reasons for the limited the PCR capacity, but the most important reason was that Japan did not have a SARS, MERS, or the human cases of avian influenza. As Zeynep mentioned, in South Korea, they had enough the PCR capacity because they had a MERS outbreak in 2015. Also in Singapore, every hospital have PCR capacity because of the SARS outbreak in 2003. Fortunately or unfortunately, we did not have these outbreaks. And after 2009 pandemic, as Kazuto mentioned, we did recommend to improve or to strengthen the PCR capacity, but it didn't happen. But I understand that the majority of criticism by foreign media was Japan was unlikely to control COVID-19 due to limited testing, which I don't think is true. As Zeynep mentioned, the mass testing or the testing of everybody is not effective the way to control the COVID-19. Although our PCR capacity was quite limited in the initial phase of outbreak pandemic, we managed to identify the most of clusters in Japan during the first wave, which was effective in reducing the transmission. And until the May 2020, our number of cases and the deaths were much less than in the other G7 countries. So we had enough the PCR to suppress the transmission, but it was true that our PCR capacity was quite limited in early stage.
Right, thank you. The another important mitigation measures, of course, is one is a vaccine, but also another is a mask. And what is interesting from the Japanese perspective is that there are a lot of anti-mask, anti-vaccine campaign. And I'd like to ask Zeynep and Geroid for the difference of the way in which the Japan approaches to the mask, because I mean, we don't have the mask mandate or any obligation to wear a mask, but still, if you go out the city, then, you know, I think that more than 90% of people are wearing masks, and people are just we don't see any, you know, anti-mask or anti-vaccine campaigns, although there are very few people who are anti-vaccine, but still, you know, it's a very small minority. So what is the case? Why is it the case in United States, for example, and Japan? What is the difference, and does it contributed to the difference of the number of cases, hospitalization, and the death? So first, Zeynep, please.
I think I can't really tell you why doesn't exist in Japan for the anti-masking, but we know that culturally and also scientifically there was a tradition of mask wearing, especially during flu season. So that I know was already there. So in the United States, a bunch of weird things happened that is kind of hard to explain. But one of them was we started with being told that masks might actually be harmful. Like, we didn't just get told, don't wear masks. There were officials saying, don't wear masks, they will increase your risk of infection. That is how I started writing about the pandemic. Like, I started writing about the pandemic in February, first because everybody was saying, why don't you just worry about the flu instead? Don't worry about it. This is unnecessary panic. And I thought, wait, pandemics happen. It's a novel virus. This is happening clearly. Like, Diamond Princess made it very clear that it was going to spread. So I started writing that, but I thought that would be it. Like, I would just write a thing saying pandemics happen, we should get ready and be done. Like, I'm a sociologist. I didn't think I would be writing anything else about all of this. And then when I started hearing our officials and WHO say, you don't need to wear masks, and our public health officials were saying things like they could increase your risk of infection. And we were in a very polarized moment. It was President Trump, and the country was like very polarized for or against them. And I thought, okay, like maybe our CDC is under political pressure, and who knows what's going on, because when you have that, and I waited for our universities, our former head of CDC, like our medical establishment to come forward and say, wait, of course we should wear masks. This has got pre-symptomatic transmission. WHO guidelines say you should only wear a mask when you're sick. We don't even have testing. How are you supposed to know when you're sick and it's spreading pre-symptomatically? Of course you should wear a mask. I waited, and this is a funny bit. I started tweeting about this, and I just put out all the arguments for why we should wear a mask. And I hoped that somebody else with the right PhD and credentials and stature, like somebody who was the head of a medical institution or a specialist, would write it. And it was after weeks of that not happening, I finally thought, I usually write about society and science and technology, complex systems. I just thought, you know what? I should write something saying this doesn't make sense. We should wear masks, especially because of the transmission without symptoms and source control. We don't have tests. This is the weird thing. Like, I wrote it thinking this is perhaps the end of my public writing career, because I am contradicting the WHO and CDC. And I am doing it without the proper credentials that would normally go along with it, because it's like, I mean, I adore WHO and CDC's role in the world. I'm very much for public health. I think they're underfunded, especially WHO. So it's not like I'm against the institution at all. In fact, a lot of people try to destroy those institutions, and I think they're crucial. But here I was starting a pandemic, opposing them by simply saying we should be wearing masks, and the idea that they will harm the wearer, I just I couldn't even figure out how on earth that was supposed to happen compared to not wearing masks. There was some things about like taking it off, and like, well, if the virus is outside of your mask and you're touching it, if you don't have the mask, well, then that's directly your face. I just couldn't make sense of it. So this is how we started, right? This is people, like the whole medical establishment, including on the liberal side, not just President Trump, being very much against them. And it took a long time to convince, including the WHO, that we should be wearing masks. And at some point, like if we have a shortage, fine, we wear cloth masks, but we should like do what, say Taiwan's done that too. Like they started distributing rationing so that everybody had one. And then at some point, this switched, and people started like wearing masks as a symbol of being responsible, and the other group started treating it like as a restriction, and it just never got righted, I think, after that initial weirdness, because it's a political thing, how it became polarized, and then people started like acting like refusing to wear a mask was a big deal, and then years passed, and we also didn't have very sensible rules in a lot of restaurants. You're supposed to wear a mask when you get up, but not when you sit down. And like there was no ventilation controls or airborne disease. So it like, I can understand when the rules don't make sense. Some people go, why are we doing this? Like, does this virus only operate when you stand up? Like that obviously doesn't make much sense. So it just became worse and worse and worse. And at some point, I think it became essentially completely symbolic. People are no longer arguing about a tool, which I thought of it as a tool. I mean, cloth masks, are they the optimal? No, but you had nothing else, you wore that, right? And then you surgical masks and N95s, depending on the situation. But we couldn't really have those sort of unemotional discussions. And I just, so this is I'm explaining something that doesn't make a lot of sense, how it became so terribly polarized, but it was, US entered it already in a very polarized way. And the WHO essentially saying you don't need to wear a mask for such a long time. It was until December of 2020, when WHO said in a guideline, yeah, you should wear masks indoors, even if you can distance. It took them almost a year to do that. So it's a global problem. So you tell me about the rest.
Yeah, well, I think what you're saying is partly makes sense, because if we put the this elite panic or the confusion that the establishments, CDC, WHO, they all made mistakes, and they try to make some sort of a try to make sense, and then the more they do, then it just confused people, and that's one of the reasons behind it. And apart from that, there was a political divide and sharp cleavage between the society, within the society. So I think that was another unfortunate drive for this problem in the United States. So Geroid, what's your take on, what's your observation of Japan from your perspective?
Yeah, maybe we should have had someone opposed to masks on the panel, because I'm basically going to say the same thing, except from the opposite perspective. I think obviously Japan had a sort of natural advantage in that people were, before the pandemic, the mask was something that was familiar to people, during flu season, during, hay fever season, which goes on for a long time here, as people with hay fever will know. So it didn't become, just exactly as Zeynep said there, it didn't become a symbol of anything. It really was just a tool. And I think the other thing that was crucial in Japan was the consistency of the message. And the message essentially hasn't changed in terms of masking from day one. In that in Japan, it's always been wear a mask. It'd be great if you wore a mask in a high risk situation. And that's basically been as complex as the message has been. So it's been sort of simple and consistent. Whereas, you know, looking from my perspective at the US, how many times have they changed, you know, how many masks you're supposed to wear? First it was 0, then it was 1, then for a while it was 2, then it was back to 0 again. Then earlier on this year, it was 1, but it has to be this special one. And now it's 0 again, even if you're on a train or a plane. And I can fully understand why people, you know, would be confused and would be opposed to that. And the other thing that I would say that I think sort of benefits Japan is that because the restrictions were not as onerous as they were elsewhere, the mask did not become that symbol of, you know, of lockdown, which I think it seems to have become in a lot of other countries. Almost the stricter the country was, the more they were likely to, even people who were responsible and who wore masks, you know, during the pandemic, they were more likely, now we can take it off, now we're free. Whereas Japan, I think Japan's measures have been, because they're not as onerous, they're a lot more sustainable. And that means, as you say, you go out today, 90% or more of people are still wearing masks. So yeah, I basically in 100% agreement with what Zeynep had to say there.
Right, thank you. So then the next point I'd like to make is the closing of the schools. I think in Japan, there was an initial attempt of closing schools, but later in the pandemic, Japan has refrained from closing school, kept open. And but on the other hand, the United States and elsewhere, the closing school has been a big issue. So how do you assess? I would like to ask Hitoshi and Zeynep for your assessment on why Japan decided not to close the school while. Was it really effective for closing school in the United States? So Hitoshi first, please.
So from epidemiological point of view, we know that the school closure in early stage of outbreak is quite effective for influenza, both seasonal and the pandemic influenza. Because the children are a major driving force for the transmission. But the COVID-19 is quite different. And especially before Omicron, the children, it was obvious that the children was not the driving force for the transmission. So the closing school has a little effect in the reducing the transmission in the community. During the Omicron wave, the proportion of the cases among children is increasing significantly in many countries, including Japan, but still it's not like influenza, and I don't think the children are the driving force for the community transmission. The children, they may be the reservoir for the transmission, but not the major driving force. And also for seasonal influenza, actually, we've been doing the partial school closure during seasonal influenza for many years in Japan. But for the seasonal influenza, we have the limited duration of outbreak of seasonal influenza. But for COVID-19, we don't know how long it will take. We should consider long-term effect on education and so on, and also the social impact by implementing the school closure. and we don't discuss much about school closure because of these limitations, epidemiological limitation, and also the negative impact on education and the society as general. Back to you.
Zeynep?
So I want to, I mean, in the US, it has the same problem. It got fed into a very polarized debate. And so it became less about the tools. But early on, I think a lot of places closed schools, as Professor Oshitani said, because with flu, children are a major conduit, and it does really work. So I think as a precautionary first step, it was a very reasonable, because you don't know what on earth is going on. You don't really know what the mortality rate's going to be. You don't know what's going to be the effect on children. You don't know a lot of things. So I think in spring of 2020, extra precaution was warranted given the uncertainty. At some point pre-Omicron, we started getting the information that indeed the children were getting affected, but they don't seem to be key super spreading conduits as much, because we weren't seeing that. So after that, it got really complicated in the US, because part of the thing is that schools aren't just kids, right? There are families, there are staff, there's other people. And if you don't have effective control of the pandemic, and I think if the institutions aren't trusted to have effective control of the pandemic, a lot of teachers were reluctant, because they were thinking, why am I going back to this situation where, like, they need to be able to trust that we're doing what we can. And but there wasn't attention on essentially like either masking or looking at ventilation in schools, all those other things, timely testing, or the things that people would need to be able to trust. And there was also a lot of sort of confusion over what could be done for school outbreaks. And if we were detecting them, we didn't even know, like, you need to be able to trust the numbers to know if somebody comes and says to you, children are not the major drivers. If you don't trust the government or the public health institutions to tell you, or for them to understand, then it becomes really, I think, understandable for people to say, this is my kid, I'm not going to take that risk, or this is so there was this kind of like wariness that came from not being able to rely on what they thought was happening. And then it got into a really other polarized debate where some people sort of started debating if kids didn't transmit at all, which isn't true. Of course, like even early on, they did occasionally, of course they did. It wasn't like a binary thing. It just wasn't like the flu. And so you had to get into the trade-offs between, education and epidemic and consider the length of the thing. And perhaps what might have worked would have been in the pre-vaccine era, have sensitive indicators so that, like, if you had a major outbreak at some point, because the staff, they go to the staff room and they do all of this. So we had all these very weird situations. I remember in one case, and this is not a rare case, where they closed the school, but they made the teachers come and teach from the school. And I just remember thinking, this is the absolute opposite what we should do. We should put the kids in the room and maybe put young people as minders in the room and let the elderly teachers zoom in. Right? Why are we, like, they are the ones that are most at risk, because they're going to be in the staff room, they're going to be in the lunchroom. So we closed schools, but then created the risk situations inside them. And of course, teachers reacted very badly to this. They were like, we don't want to, this doesn't make sense. And it didn't really make sense. So I think the general lesson here is that if your public health institutions and your government, and again, in the United States, we had just come out of the Trump era, like we switched administration in the middle of it. And also, if your sort of public health institutions aren't seen as credible, everything else goes wrong after that. Because if people don't know what to trust, then, like, I don't really want to, so people criticize the teachers, and I'm kind of like, well, if you don't really know what's going on, like I read a million papers now. I read everybody's papers. I've learned a lot, but like, what are people really? You don't go to a supermarket with a chemistry lab to test if everything you buy is poisonous. You're supposed to trust that the food chain has been monitored, there was a cold chain, and that if there's salmonella in your chicken or eggs, or if there's E. coli, that's a scandal, right? You're supposed to trust that without having to read a million papers about infection control in the food chain. So we didn't have that. And I think that's the crucial missing thing. It's like even when you have the science, if you don't have people trusting that the scientists have this under control, I'm telling you, and in the US we still have so much confusion over things that I think are fairly uncontroversial, if you ask me. But why should anybody trust me, right? It should be, I'm genuinely saying this, it should be the public health authorities who speak and are believed, and there's no role for people like me or anybody else, to be honest. It's not just that I'm not a medical doctor, it's that it shouldn't be any single person. It should be the institutions that tell you this is what's going on. So the school situation got wrapped up in this broader dysfunction. And this is my answer to most of the questions, is the broader dysfunction ate into the pandemic response.
Right. Thank you. That reminds me that we are so happy to have Dr. Oshitani to be as an epidemiologist who are trustable. And I think that was one of the key lessons to be learned from Japan, that, to have the trustable, reliable experts on epidemiology. And that's perhaps the key message key takeaway from today. But before we go into the Q&A, I'd like to ask Geroid for your take about the Japan's or the issue with regard to the Olympics. There are a lot of big chorus of the a cancellation of the Olympics. Yes, we postponed for 1 year, but even into 2021, there was a big chorus, and because it was a middle of the fifth wave. But I think you have mentioned that even though this is during the pandemic, but the Japan's measures to have this bubble system, and also I think the impact on the Japanese societies are limited. So could you tell or recollect your thoughts during the Olympic time?
Yeah, certainly. As I mentioned, the Olympics was the only other time after the Diamond Princess that I felt the media outside Japan really got interested in what was happening here. And I think really sort of many things became, conflated with the Olympics. First of all, there was the fact that it was postponed in the first place, which was sort of an inevitable decision and a correct decision, and trying to hold it in the summer of 2020 would have been very difficult. But I think a lot of the initial concerns sort of stayed in the public sphere even after they had already been dispelled. Now, obviously, there was risk involved in holding the Olympics. At the same time, this would be true even if there wasn't COVID. There's risk involved in everything. You could imagine if you were holding the Olympics, a month after the initial seeding event in Wuhan, the Olympics could truly turn into a super spreader in a situation like that. But I think once we had reached sort of spring 2021, it was clear that sort of the rhetoric around the Olympics was not appropriate to the level of risk. I think there was a legitimate cause for concern and for people to be concerned, in Japan, when plans involved bringing in millions of foreign spectators and participants, and there were no vaccines. That would certainly be a concerning thing to do in the middle of a pandemic. But ultimately, the people who came in were mostly, so there was no spectators, full stop, including domestic spectators. The people who came in for the event, were mostly vaccinated. They were tested on entry and then tested, every day thereafter. And I think the crucial thing is they were just, a fraction of the millions of people who move through Tokyo every day, even in the state of emergency, which was going on at the time. And if anything, I think by the time the Olympics actually happened, the participants who were coming in and the event organizers who were coming in were probably the safest subsegment of the population you could possibly be in, because they were the ones who were most likely to be vaccinated and tested versus everybody else who was in Tokyo at the time, who was much less likely to be vaccinated. And I think the confusing thing for me sitting here in Japan was watching the fuss around the Olympics take place, even as the Euro 2020 took place in Europe. It was also delayed by a year, but the exception, the difference being there that it took place with full stadiums in many countries, definitely at least partially full stadiums in all countries, and crowds who were cheering mostly without wearing masks. And yet there was no criticism of that, and there was a criticism, heavy criticism of the Olympics. I think that tells you that, the true criticism of the Olympics is probably not to do with the pandemic, but probably to do with something else. And I'll leave people to fill in their imaginations what that might be.
Right. Thank you. So we have a couple of questions coming in. And we do have 15 minutes to go. So I'll just give some of the questions right now. The researchers at the Kobe University is asking question, Japan was slow to start with the vaccine rollout, which jeopardized the Olympics. Why was it so late? Perhaps Hitoshi, could you answer this question?
As you know, we are using messenger RNA vaccines, the Moderna and Pfizer vaccines. Both of them are imported vaccines. We still do not have the licensed local vaccines. And the procurement took time for the Japanese government to procure enough vaccine to cover the whole population. That's one reason. And also, in Japanese society, the equality is important to know. And the government did not start the vaccine rollout until they have enough vaccine to cover all target population. And also until all the local government were ready to vaccinate people. And so this, the too much focus on, or the too much emphasis on the equality in the Japanese society, that sometimes has the negative impact. And the delay in the vaccine rollout has this kind of aspect. And especially for the third dose, but also for the first two doses. Back to you.
Right. Thank you. The next question is coming from a public official from the Philippines. How can developed countries truly influence or assist the developing nations to adopt the first world culture to ensure the pandemic resilient the world? That's a tough question to answer, but I'll ask Zeynep to respond.
Well, I want to say, I think we have exposed a lot of gaps in all sorts of countries, and it crosses the boundary. Like Uruguay did great. It's not the wealthiest country in the world, but they took some precautions early on. They adopted certain strategies. There's a number of countries that did fairly well. I count Vietnam is not the most democratic government, and it's not very wealthy. But in some sense, they held out fairly well until they got a Delta wave and they couldn't purchase enough vaccines. They just didn't have enough money and supply was limited. So they were back of the line and they suffered after that. But before that, they were doing fairly well. So I think like it wasn't even just wealth, but it was also having a proper like a public health approach to it that was really important. But that brings me to the second thing is that developed nations have, I think, done fairly terribly with the vaccine equity issue. I mean, obviously we need the vulnerable people to get vaccinated as early as possible. And that needed to be a global approach because this is a very, like the age effects are, you know, almost super linear. The elderly are much more susceptible. And we had, I mean, honestly, in the United States, we had 12-year-olds be able to get vaccinated when healthcare workers in poorer countries still were waiting for their vaccine and the elderly. And what we didn't do was we didn't scale up the production, how to get those out. So I kind of don't want to say learn from developed nations. I think there was a lot of failure all around. We need to, again, as I said, I'm very, very supportive of WHO as a crucial institution. We need to fund it better. We need to do better, but it also needs to have better experts. Like there's no question that it did not do very well, I think, in terms of providing timely guidance, because if you look at what Japan did, it did not do what the WHO advised at any sort of most of the pandemic. It went against the advice. And you could do that partly because, as we've been discussing, you have people like Professor Oshitani and his team and colleagues who figured things out, and you guys could do that. But for a lot of developed nations, WHO guidance was what it was. And I remember well into like India's Delta wave, which killed an incredibly large number, unfortunately. I and my authors, we had published an article in The Lancet that was kind of explaining airborne transmission, all of that. And officials from India were trying to use our paper to try to get more like airborne specific mitigations in the middle of their way because the WHO guidance was not helpful. It was still very oriented towards a sort of this, it was this mixed message in it. So I think what we need to do is learn from the failures in a sensible way. I know that nobody wants to sort of do what looks like scapegoating, but it's the way you understand, like if something goes wrong, it's not about blaming the individuals, but it's about figuring things out so that we can do better next time. So I wouldn't say, you know, developed nations have some ready-made lessons to send to developing nations. It's that we have a bunch of examples where some countries have done more sensible things in a timely manner, while some countries and some institutions really had major issues and they're unevenly distributed. And what we should do is we should collect. And to go back to one of the countries that was like ready with the testing, like South Korea, one of the reasons they're so ready is that they had a MERS incident earlier, which they did not handle very well. And it was a bit of a scandal. And there was this study and there was this, we are going to be ready next time thing. And they did that for a smaller epidemic. And thus they were readier for when a major one came along. And I think that's kind of the approach, is that unfortunately we had a pandemic without being globally ready. That's the way forward, is to learn as much of the lessons of the positive cases as we can, not about blaming people, but understanding how to fix all of this. And that's, to me, is the key way to do better next time.
Right. Thank you. I think, you know, this is one of the reasons why we do this webinar, to learn the success and failure, you know, the points that you can learn from the experience of other countries. And I think Japan has a lot of experience and a lot of good thing and bad thing that to learn. I mean, this issue of trust, issue of the, you know, the social obedience in a way, you know, how to implement these cultural issue as well. And I think each country has, you know, advantages and disadvantages, you know, any lessons can be learned. And I think what is interesting is to, like in case of South Korea, people learn and prepare. for the next time. And I think that's extremely important. I think we can take one more question, which is the Oshitani sensei mentioned that the lockdown was not possible because of the legislative reasons. Could you explain this aspect in more detail? Hitoshi, please.
Okay, so we have a special act for the influenza pandemic, and the state of emergency was declared under this act. But even within this act, there is no the lockdown type of measure was considered, and there is no penalty who do not follow the lockdown measures. And so we have the very limited legal enforcement power for the pandemic response, including COVID-19 response and the future pandemic. So the most of measures are on a voluntary basis, and for the strict lockdown, to implement the strict lockdown, the law enforcement power is probably necessary. That we don't have such the legislation system to implement the very strict lockdown, and but the people generally follow the government advice, both the central and the local government advice, and that's why we managed to minimize the impact of COVID-19. And I don't think lockdown is a good option for Japan, the country like Japan. There are some discussion if we should have some law enforcement power for the lockdown to be possible, but I do not think that's a good option for the country like Japan.
Right. Thank you very much. The time is almost coming to the end. But I think this was a very interesting discussion, and we are having the very interesting look at the Japan's case without sort of a bias through media. And I think it is important to have the data and the facts in your hand, and to understand without really putting a blame on somebody or trying to politicize the issue. And I think one of the outcome or takeaway from our webinar is that we need to have the trusted relationship between the experts and the people. People need to listen to the experts, and the experts need to provide a consistent message. And I think one of the success in Japan was because of this concept of 3 C's, which were very, easy to understand, but it was effective and very, I think it was a very good risk communication. And I think that was the part of the success, and it can be taken away and be learned by many other countries. And I think there are other things that we can learn from that, but this is still an open question. We haven't really seen the end of the pandemic. So we will we may need to have this session again in the future, but so far I think there are a number of issues that can be learned and discussed through the Japan's experience. So I again thank you, Hitoshi, Zeynep, and Geroid, for the wonderful discussion, and I hope that the audience will have something to take away. And finally, please fill out the assessment in the link below after the webinar, and by scrolling down, and the next session of this Asia Undercurrent is about the Quad, which is coming up in the May 17th. So please join us again, and I hope that you would have another interesting discussion on the international relations. So again, thank you very much for coming, and thank you very much for wonderful discussion with all the panelists, and thank you very much for the government of Japan and Nikkei for supporting this. Thank you and bye-bye.